From the academic year 2019, the medical curriculum has been changed. Here they have included 5 learning modules of AETCOM for first professional year of MBBS. AETCOM stands for Attitude, Ethics, Communication. So module 1.5 is Cadaver as our first teacher. In this module, we will learn to respect the cadavers as a teacher, which will translate later into respect for human beings. Also, we will know the importance of biological tissues and cadaver in our learning process. At the end of this session, students should be able to describe the role of cadaver as our first teacher in anatomy, describe Body Donation and Anatomy Act, describe embalming, describe rules and regulations in dissection hall, and describe biomedical waste. When we get admission to the first year of MBBS, we have to study 3 basic subjects: anatomy, physiology, and biochemistry, of which you will remember anatomy lifelong, because in the dissection hall of anatomy department you will encounter a dead human body. These dead human bodies are known as cadavers. The word cadaver is derived from Latin word cadere, which means to fall or to perish. So when we use a dead human body for scientific purpose or medical research to study anatomical structures, it is known as cadaver. The cadavers we work on during our academic year in anatomy department are either obtained from forensic mortuary through a medico-legal procedure. These are mostly unclaimed body, and the other sources donated bodies. How do we study anatomy with the help of a cadaver? It is by doing dissection of a cadaver. The term dissect is also derived from Latin word dessicare, which means to methodically cut up. So what is the difference between simply cutting up and doing dissection? For dissection purpose, we use dissection manuals, which provide us instructions on how to methodically cut up the dead human body to identify the anatomical structures, to see its relations and variations if any. Thus, the term dissect refers to cut apart the body of a human to study its anatomical structure. Anatomical dissection of cadaver is a time-honored part of medical education. Cadaver is going to stay along with you throughout the academic year. Cadaver will teach you right from the method of incision over the skin, approach towards the organ, its relations, its anatomical position and variations if any. Thus, cadaver will be your first teacher in anatomy, and you have to respect your teacher. To show respect for cadaver, in some countries like Thailand, they have taken initiative. There they conduct a ceremony called Vaikharu. In this, the cadaver donors are honored with a special status of Ajarnayai, which means a great teacher. Since 2019, our curriculum has changed to CBME, Competency Based Medical Education. So we have included cadaveric oath in the AETCOM module to show honor to the departed soul who has donated his mortal remains for medical purpose, so that budding doctors can study on it, do research on it. So this is absolutely a noble cause with no financial gain to the donor, and it is our duty to study on it with due respect, maintaining ethical and moral values. Cadaveric oath is administered to first year medical undergraduates who pledge to honor the dignity and integrity of human remains that they are about to work on. This provides an atmosphere of reverence and respect towards the cadavers. This feeling of gratitude helps to inculcate humility, caring attitude, sympathy, and love in the budding doctors. Being a doctor, you will face realities of life. You may bring a new life to the world, or you may have to take efforts to treat the patient till their last breath. So, birth and death are the realities of life that every budding doctor will inevitably face in his future career. The next point is you have to be empathetic. So, you have to show empathy to the patient. That means to think ourselves in the position of patient. At the same time, you have to detach yourself in a particular harsh situation. That means you have to show the real status of patient's health without hiding anything from the patient. So when to be empathetic or when to detach yourself in a particular situation will be taught to you by the cadaver. We have memories of death of some of our near ones, right? Everyone has that memory and we are quite afraid of it since childhood. But as soon as you enter the medical field, your first encounter is with dead body. This makes you more resilient for the upcoming medical realities. In future, you will become a good clinician and you will treat the patients. Now imagine cadaver as your patient. Cadaver is a mute patient who will allow you to gain anatomical knowledge, develop surgical skills with right attitude. If you make any mistake while treating a patient, patient will suffer its consequences and he may sue you to the court of law. But here, in the dissection hall, you are benefited with a non-reactive patient who provides you an opportunity to acquire better understanding of gross anatomy integrated with structure and functions. In general, we learn under three domains. Cognitive domain is for knowledge, psychomotor domain is for skills, and affective domain is for right attitude. In the dissection hall, by visualizing and having tactile access of anatomical structures, you will gain knowledge and enhance your cognitive domain. By doing dissection, you will become competent in surgical skill that will foster your psychomotor domain. And you know that the cadaver you are working on was once a live person like us who lived with honor and dignity and donated body free of cost for medical purpose. This will definitely develop humanistic attitude and behavior. Thus, all the three domains of learning are taught to you by your first and forever teacher, that is cadaver. Nowadays, cadaveric workshops are trending among surgeons because surgeons are trying new approaches, new techniques, laparoscopic procedures which are mini-invasive and have minimal complications. They can't be directly experimented on live subjects. So the safest method is to try it on cadavers. It proves very helpful to newer surgeons. On cadavers you can take ample of time, you can sharpen your skills and explain the students simultaneously. Almost every branch of medical profession, may it be surgery, gynec, orthopedic, ENT, they are organizing cadaveric workshops for active learning of manual skills. Hands-on teaching on real cadavers is the first experience of structural organization of the body, both at surface and in depth. and it leads to a real understanding of three-dimensional configuration of anatomy of the body. The student cadaver patient encounter is paramount in medical education. As we discussed earlier, if we commit any mistake while treating a live subject, we have to bear its consequences. We are punished for that. We may be sued to the court of law for negligence. But the cadaver provides us opportunity to use instruments to sharpen our skills, to use new techniques and get acquainted to it, and then try it on the patients. Dissection is an active process of learning where the students are in explanatory mode and they are more likely to remember anatomy by doing the dissection rather than simply mugging up the text. In the dissection hall, students are divided into small groups of 8 to 10 students approximately, and they are allotted a dissection table with a cadaver who is going to stay with the students throughout the year. So as the time passes, these students develop bonding with the colleagues and allotted cadavers. They work as a team. They interchange their knowledge, ideas, and they respect others' opinion and acquire communication skills. This gives them confidence and enriches their clinical competence. When you become a doctor, you work in collaboration with the healthcare system formed by interprofessional team with diverse knowledge. So you work with your professional colleagues, nursing staff, soft skill experts, counselors, social workers, with the patient with harmony. Now in dissection hall, small groups are formed. Batch teachers are allotted. So you have to work as a team. You develop bonding with them. In the dissection hall itself, you start developing spirit of teamwork, patience with integrity. Aspiring surgeons can master the surgical skills or procedures without harming anyone. We fail to acknowledge the dead as persons worthy of our time and attention. Let us never forget that every cadaver is a human anatomical gift without which our teaching and learning experience would be incomplete. The greatest role of cadaver, which students often overlook, is that of teacher. Students should remember that these cadavers were once live individuals like us, with distinctive personalities, thoughts, feelings. That is why it is essential to maintain etiquettes in the dissection hall. When a person selflessly donates body for the academic benefit, it enlightens knowledge in the mind of thousands of students. Person who has donated body gets no financial compensation. The body is donated absolutely free of cost. Thus, it is prime duty of students to implement and practice ethical and moral values in the dissection hall to honor or to respect the wish of the cadaver who was once a live person like us. Dissection hall is a sacred place wherein only students should be permitted in presence of teaching faculty in teaching hours. No visitors, general public or non-teaching staff should enter the dissection hall. Dissection hall is meant for academic enhancement of students. So students should make habit of strictly engaging themselves in educational activities. They should carry academic materials like textbooks, dissection manuals. Consuming food items or drinks should be totally prohibited in the premises. Misbehavior in the form of taking selfies, photographies, or making video clips in the dissection hall will not be tolerated in any case. It is the duty of students to take care of allotted cadavers throughout their academic year. The cadaver should be kept moist and covered with cotton gauze. Only the area for dissection should be uncovered for study purpose. For their own safety purpose, students should wear clean lab coats in the dissection hall. Students should use shoes, preferably to enclose entire feet. While touching wet specimens, students should make sure that they are wearing gloves, and after the end of the session, they should dispose the gloves in respective bio-waste bins, followed by washing of their hands and instruments with soap, and finally they should remove their lab coats when leaving the dissection hall. The students should be aware of potential toxicity of preservative solution. As a precautionary measure, they should avoid direct physical contact of one's skin, eyes, clothing. Students should make sure that the ventilators, exhaust fans, windows are open and there is proper ventilation in the dissection hall. This will reduce the exposure to embalming chemicals and odor. For dissection purpose, we use sharp instruments like scalpel, blade, sharp scissors, needles. Accidentally, students may injure themselves with these objects. It is mandatory to report such events to the faculty so that immediate help and management of injury is done as per standard norms. It is the responsibility of students to maintain cleanliness in the dissection hall, at least in the area pertaining to the table allotted to them on which the cadaver is explored. After taking incision over skin to visualize deeper structures, it is crucial to maintain well-defined skin flaps required to cover dissected area after the session. During dissection and at the end of the session, the removed tissue should either be preserved or it should be disposed into designated bins. Students should never make loose or casual remarks with regards to the mortal remains of the donors. The best way to learn is to practice, and best practices are those which shape the future towards better. Now we will see what is Anatomy Act and how it is related to the body donation. Okay, so the Anatomy Act is related to the collection of dead bodies for teaching purpose, and this act was enacted in India in 1948, whereas in Maharashtra it is known as Bombay Anatomy Act and it was adopted in 1949. So the cadavers you are working on in the dissection hall are received from two sources. Okay, either it is a donated body or it is unclaimed body. So what do you mean by unclaimed body and donated body? So if a person shows willingness to donate his body, he'll fill the body donation form in an approved institute, and after his death his near relatives will bring that body to the institute for medical or teaching purpose. So that is donated body. Or the other source is unclaimed bodies, means if the death occurs in a state hospital or public place within a prescribed zone of medical institute and the police declares a lapse of about 48 hours wherein no close relatives of the deceased approach to claim for the body. So such unclaimed bodies can also be used for medical purpose. So this Anatomy Act is related to the collection of dead bodies for teaching purpose, which can be unclaimed bodies or these can be donated bodies. So here there are some important terms you should know. So what is unclaimed body? It means the body of deceased person who has no near relatives or whose body has not been claimed. by any of his near relatives. Then who are these near relatives? They can be wife, husband, father or mother, son, daughter, brother, sister. So these are all near relatives. And also the death should occur in approved institute, we say. So what is this approved institution? It means a hospital or medical or teaching institute which is approved by state government. So the state government also elects an authorized officer who is known as coroner. So this coroner is government official officer who confirms and certifies death of an individual within a jurisdiction. So he may also conduct or order an investigation into the manner and cause of death. So the collection of dead bodies for teaching purpose is provided or guarded by an Anatomy Act. Okay. Anatomy Act is an act related to fulfillment of need of unclaimed bodies at required institute. So nowadays medical colleges or institutes are increasing. So the demand for the cadavers is also increasing and the unclaimed bodies alone cannot suffice the need. So there is another option. So the other best source to overcome this demand of bodies is body donation. So under the Anatomy Act, one must register for the will of body donation prior to his or her death. So any hospital or medical institute which is approved by state government for medical education and research can accept the body. So before the death, if any person is willing to donate his or her body, then they should fill the body donation form which is provided by an approved medical institute, and after his death the relatives can bring the cadaver or the body, dead body, for teaching purpose. So it will be accepted by the medical institute for medical education. So if a person is willing to donate his or her body, then he fills the body donation form which is available at approved institutes. So if the person does not fill the body donation form and is willing to donate his or her body, in such cases he may donate his body. His close relatives may bring the dead body in the approved institute means after death. And there are various organizations who are working for body donation program. So even in such organizations we can donate our bodies. So this donated body is then forwarded by the organizations to the approved institutes where embalming procedure for preservation of the body is done, and such institutes are again approved by the state government and they are registered under Anatomy Act. And after that, means once the body is received by the institute, all the legal rules, regulations, ethics are followed uh, as per mentioned by the Anatomy Act. And then after using the body for medical purpose, this the remains of the body are properly disposed without disturbing other local environment, and the institute keeps all the updates or all the records in the form of documents and certificates regarding the body. Means when we are receiving a dead body, we ask for the death certificate wherein the cause of death is properly mentioned by a registered medical practitioner. Also the identification certificate, may be Aadhaar card, is taken. And in the COVID era we have also received the RT-PCR reports and the identification, if available, of the witness or close relatives. So all these updates or records are maintained in the approved institute regarding the body. Criteria for non-acceptance of a donated body are: autopsied body, means the body on which post-mortem is done. Then decomposed bodies, or extreme obese or extreme emaciated bodies. So in all these four conditions, the anatomy of the body is distorted and it is not possible to do or to study on such bodies. So we may reject such bodies. Then, if the death of the person has occurred due to contagious or communicable diseases like tuberculosis, HIV, hepatitis B, there is a risk of spreading such communicable diseases to the person who is working on it. So, such bodies are also rejected. Then, we accept the bodies only if the death has occurred due to natural cause. If there is any medico-legal aspect in the cases like suicide, homicide, accidental deaths, such bodies are not accepted. Then, if a part or a tissue or any organ of the body is removed before donation, except for eye donation, such bodies are also rejected. So, whether to accept or to reject a body which has come for donation is the decision made at the time of donation by the medical institute authority. So if the medical institution authority finds any obvious reason for which the body cannot be accepted, then he has the right to reject the body which has come for donation. So once the dead body is received by an approved institute, may it be an unclaimed body or donated body, it is preserved and prevented from getting decomposed by the procedure known as embalming. So the embalming is done to make the dead body suitable for public or private viewing, as for either for a funeral ceremony, or it is preserved for medical purpose in anatomical lab. For preservation of a dead human body, we inject embalming fluid in this, and the embalming fluid is formed by various chemicals. So it is combination of various chemicals. We will see the chemical components of the embalming fluid one by one. So first we use preservatives. These are the chemicals which inactivate bacteria and they stop decomposition of the body. Then we use germicides or disinfectants which are used to kill microorganisms. Then modifying agents such as buffer, humectants and inorganic salts. So buffers are the chemicals which maintain acid-base balance. Inorganic salts are important in determining osmotic qualities of the solution, and humectants are used to hydrate the tissue. Anticoagulants are used to prevent or to reduce blood viscosity. Then the next component is surfactant. Surfactant are the chemicals that reduce the molecular cohesion of liquid. Then we use coloring agents that impart definite color to the embalming solution. We use perfumes, deodorants to reduce the raw odor of the solution, and we use diluents. They are the solvents for ingredients used in embalming fluid. So the proportion of chemicals used in embalming fluid are 5% formalin, 10% glycerin, 20% ethanol, 3% thymol, 1% phenol, and 61% water. So if we see the embalming procedure, initially the body comes is brought to the dissection hall or any approved institute for embalming process. So here we remove the venous blood from the dead human body through its internal right internal jugular vein, and then the embalming fluid is injected into the femoral artery or common carotid artery with the help of embalming machine. So with the help of embalming machine, this fluid is injected under high pressure and flow, and the other method is by using gravity feed method. So here a container is filled with the embalming fluid and it is kept at a height above the body level, so that the fluid present in the container is dispensed against with the gravity, with the help of the gravity. So this is the arterial method of embalming, which can be done either by using embalming machine or by using gravity feed method. Now, after doing the embalming or after completing the embalming procedure, we have to confirm whether the embalming is done successfully or not. So, there are certain properties which will help us to determine, or they will guide us to know whether the embalming is done properly or not. So, if the structures are preserved in lifelike situation, then we say that the embalming is done properly. Means there should not be any shrinkage or distortion of the tissue. Then the organs should be supple and flexible. There should not be over hardening of the tissue. Then after doing embalming, there should not be fungal or bacterial growth, because if there is improper embalming, then there will be growth of fungal and bacterial infection. This will make the cadaver inappropriate for dissection purpose or for study purpose, and it will also lead to spread of infection from one cadaver to other, and it will spread the infection to the person who is working on the cadaver. Then the next property is the embalming fluid used has potential toxic agents in them like formaldehyde and phenol. So we have to follow safety regulations at the workplace. And the next point is retention of color. So if the embalming is done properly, the color and texture of the tissue is like living situation, and if it is not done properly, then due to oxidation effect there will be browning, there is brown discoloration of the tissue. Then we'll see the methods of embalming. There are various methods of embalming. So there is arterial method, cavity method, hypodermic method, and surface embalming. So most commonly used is arterial embalming. As I have mentioned earlier, in arterial embalming, the venous blood is drained out from the right jugular vein. Then the embalming fluid is injected into the right common carotid artery or in the femoral artery with the help of embalming machine or with the help of gravity feed method. So, with the help of this, the embalming fluid will replace the blood in the blood vessels. So, this is the method. We can see in this picture, the embalming machine is used for injecting the fluid. So, lower down, we can see there is femoral artery, and in the neck region common carotid arteries. These are commonly used for arterial embalming, and the instruments used for the embalming procedure. Second method is cavity embalming. In this method, with the help of aspirators, the internal fluid from the body cavities is aspirated and the body cavities are filled with the embalming fluid with the help of trocar. Next method is hypodermic embalming. So, topical or local injections of the embalming fluid are given subcutaneously wherever needed. Next method is surface embalming. So, here the area which is injured or affected, uh, that much area in that much area we again inject the embalming fluid. So hypodermic method and surface embalming method are actually supplementary method. Means once after we complete the arterial embalming, if we feel that in certain areas there is need of injecting fluid as the embalming is not proper in that area, or that area is affected in by local injuries or sores or ulcerations, then topically we inject the embalming solution in that area. So that is hypodermic method and surface embalming. Any waste generated in the hospital during the procedure of diagnosis, treatment, or immunization of human being, animal, or researcher is known as biomedical waste. There are various steps involved in the management of hospital generated waste. So, first step is reduction. Reduction means to reduce the volume of biomedical waste. It is done by extracting the reusable items out of the waste. Second method is very important. It is segregation. Means the biomedical waste is separated and it is disposed in different containers or different color coded bags, and the mode of disposal is also different. So this is determined by the step of segregation, that is separation of waste. Third step is storage. So ultimately the waste has to be disposed of by doing proper treatment, but before that it is stored, and we have to take care that it is safely stored at the point where it is generated. Then comes the transportation, the point where the waste is generated in the hospital. From that point to the place where the hospital acquired waste is treated is the transportation procedure. And final step is treatment, means the bulk of the waste is reduced and it is made non infectious by treatment. Now, the second step in hospital generated waste management is segregation. So, we use different color coded bags to segregate the biomedical waste. We use yellow coded bags for disposal or segregation of infectious waste, that is human and animal anatomical waste, then bandages, cotton, body parts, and placenta. Red color code is used for infected or contaminated dressings, plaster of Paris cast. Blue code is used for the segregation of gloves, syringes, and plastic waste. Black color coded bags are used for disposal of cytotoxic drugs and chemical waste. And lastly, we use white color bags for the segregation of needles and sharp cut glasses. Now we will see methods of disposal. So the first method of disposal is incineration. So here mostly we dispose the human and anatomical waste, microbiological waste, all the solid infectious waste. It is put into a huge machine called incinerator, and the incinerator has very high temperature, so it converts all the waste products into ashes. Then the next method of disposal is chemical disinfectants. So these are used for liquid waste like blood, urine, stool, pus, sputum. So chemicals are added in these waste, and the pathogens present in the waste are inactivated. Next method is microwaving. Here we use the thermal effect of electromagnetic radiations, and it is commonly used for disinfecting solid waste contaminated with blood and body fluids. Then the next is autoclaving. So here it is again a thermal process where the steam comes in direct contact with the infectious material and it will sterilize that material. Next is shredding. So the infectious sharp waste like needles, syringes, they are cut into small pieces, they are D-shaped. Next and final is deep burial. So it is specially used for disposal of hospital waste. So initially all the waste from generated from the hospital is disinfected. It is treated and it is made non-infectious, and then it is placed in a deep burial pit which is covered by lime and it is filled with the soil.